So now going to the legs, the draping, same thing here. I'm tucking that sheet underneath underwear, and I'm doing it all quite quickly. So yeah, do jerky movements as opposed to slow. It gets really awkward. You know, people's perception is very important here when you're moving around the body, and especially with draping and getting around personal areas of the body. When you slow down, it can feel sensual and kind of creepy. So yeah, if you're wiggling around and jerking, it's much more comfortable, and they probably won't even realize what you're doing, you know, where you're at. So I'm applying oil here to all the way down to the feet, even though I'm about to start on the hammies with the same idea that I was talking about before. And here we're going to, again, I'm right down there, and I've done this. What you can do, sometimes the sheet can kind of keep getting in your way when you're working around here. So one way to kind of avoid that is you can get this sheet and tuck it up under the other leg as well as tucking it up into the underwear here. So one thing to try and avoid when you're doing the back of the legs is pressure on the back, too much pressure on the back of the knee here. So even though you might see me doing this stroke from the calf muscle over the back of the knee and up onto the hammies, when I get here, there's hardly any pressure. The pressure is maybe here, then I back off, and then I'm back in as I dip over. There's a bit here called the popliteal fossa. It can be quite tender, especially if you continue to rub it strongly. So yeah, avoid the back of the knee. You can do heaps of work around the knee, and we'll get to that when we teach different techniques, like cross fiber techniques. But for now, we're just rubbing with our body weight. Deep breath, mate. So again, I'm just slowing it down here. I'm using a big blunt surface area, but because I'm slowing it down so much and using my body weight, it's making it really strong. So having this foundation is crucial to being a really good massage therapist, to be able to do all sorts of massage, because from this point I can do a very nice, more Swedish style massage, which still has me able to go stronger within that stroke and then back off very comfortably without straining. I can just be here very soft, lean my body a little bit harder, back off again. Gives you this incredible control when you get this technique down pat. Just letting his breath catch up, because I can feel that this is going to be quite a tender area for him. Now here I'm just going to change the angle of my body, still using body weight. I'm just leaning it onto his hammy. Here I'm more on the lateral side of the hammy, sort of more along biceps femoris. So what you can do here is cover the back of the legs all the way. Don't go too far on the outside. You don't need to get into the ITB here yet. Stay like this. Here what I was doing, you're probably noticing my elbow being out there. That's because what I'm doing here is getting into the more medial part of the hammies here. If I was to do that with my hand, I'd get to the point where my finger's going to go off into the genitals. Twisting the hand that way and having your arm straight makes it almost impossible to get into that area. So your elbow's out there, it's pretty strong, your shoulders are back, your body weight's on this other hand, and you're just moving through with this posture, and you can really start getting more of the medial hamstring muscles here. And then you can just move further out, and you can literally keep your elbow at the same position. You're just getting further away from the table, and that way you can cover the whole hammy. You can do it like this as well. Here I'm just using my hands like that. The area that's putting on the most pressure is like my thumb and my fingers here. And I can transfer them around like that. And getting to the calf muscle, it's just rinse and repeat. You're just going to get to different areas of the body, and then you're going to use a different tool. Calf muscles are more tender, and you don't need to put much pressure at all onto these. In actual fact, I like to kind of teach people to treat the calf muscles a bit more gently than you do the rest of the body. What happens when I teach deeper tissue massage techniques, what you're trying to do is work at this level where you're working just before the point where someone tightens up and resists, right? But you're looking for that so that you can have a gauge of where you're at with someone. So you're looking for a response where they're like, whoa, okay, this is uncomfortable. But then you back off just a bit before that. What happens when people get to the calf muscles, it's quite easy to get that response, and if they haven't been successful in getting the response from other areas of the body because they're still learning, they get to the calf muscles and they destroy them. Try not to destroy people's calf muscles, they're tender, and warm them up, give them a good warming, you know. Make it comfortable. Here you can see I'm just using my hands mainly. I don't even have to use my body weight. Again though, this is important, my hands are strong. If most people do this, it's going to feel like a rub on the skin. I'm not doing that. When I do that, it's actually quite strong. I guess it's like, if you on a scale from 1 to 10, it's like a 4. I'm just going to adjust the focal length a bit and zoom out. There you go. That's better. See, as soon as I make it even a little bit stronger, Leroy's a bit uncomfortable. I'm just going to really try to make this massage that type of massage where they're not uncomfortable very often. You know, they definitely feel their points. Like Lee was just saying to me that, yeah, he could feel this, and you know, he said he's a bit tight, a bit tender in his hammies and a bit tender in his upper traps, and he could feel it there. And so even though I'm not trying to focus on those particular areas, when you do this type of massage, you will just make people aware of their bodies if you're doing it correctly. You want to make people aware of where their blockages are, where their tensions are. It's kind of like you're educating them on, this is what's going on in your body. That's what this is about for me, you know, like what you can do with so many different treatment styles that exist is you can treat discomfort in the body and ailments in the body, and people will never actually know or become aware of what's going on in the rest of their body, you know. You might go to the chiropractor, he cracks your neck, you feel a bit better, but little did you know how tight and blocked the rest of your body is. So it gives people a really good gauge that they have a lot of work to do, because you're making them aware. You know, you thought you had a sore neck and you're complaining about your sore shoulders and, you know, the typical stuff. But hey, did you know how much tension was in your hammies? Did you know your calf muscles were so locked up? So that's the benefits of learning how to do massages that address the body like this, learning how to get into every part of the body, so that you can just also at the same time make people aware, like, hey, this is what's going on. This is, you know, this is your body. Let's work on it. It gives them, like I said, a really good reference point of why they're actually laying on your table. My business, when I was doing massage, mainly treating, I was seeing people, 90% of my clients were weekly or fortnightly. And that wasn't from me telling them they need to see me. That was from them becoming aware of all their tensions and asking me how often they should see me, and me recommending come and see me for sort of 3 to 4 weeks, once a week, the first 3 to 4 weeks. And then you decide, see how good you feel. You decide how much you want to see me based on what this does for you. From setting that up, starting off like that, my clients decided to see me for years, fortnightly or weekly. So, you know, it's because I made them aware that, hey, there's an issue, there's stuff to work on. A lot of people don't necessarily, if they feel there's nothing to work on anymore, they might not come and go see you, you know. Where there's always something to work on in the body. There's so much stuff stuck in our bodies, so much build-up of tensions and, you know, pressures of life, etc. that, yeah, you can get a massage every couple of days. So, what was I doing at the feet there? So the video just stops, so I'm going to just say this stuff again about the feet. Don't do too much of the stuff I was doing at the feet unless you're very, very strong. Very strong, I mean, like, you know, very comfortable with, maybe if you're doing weights or something, or you do a lot of chin-ups, then your hands might be strong enough, or if you're maybe a builder. But initially, hold points. Move around the bottom of the feet, just holding. Don't feel like you have to squeeze in and get in really deep. Just hold for a couple of breaths. Either your patient's breath, if you can't see if they're breathing or not, focus on your own breath. Move to another point of the foot. So the reason I say this is because most people won't have the strength to work the feet deeply, and not even necessarily deeply, more than just superficially. Most people, when they get to the feet, just kind of rub the feet, and it can actually be almost ticklish. So until you get strong, until we get to the point where I'm teaching you guys how to do more detailed footwork, for now, easiest way and a very, very effective way to treat the feet, save your energy, make your client feel grounded, sedated. Yeah, see that? What was that? Did you just kind of twitch to sleep then, Lee? Or was that?
I think so, yeah.
Yeah, okay, so there, exactly what I said, was talking about. Often when you do these holding techniques, patient will just go bam, and they do this huge, freak out. It looks like they're just falling in a dream and they've just hit the ground or something. So yeah, hold, ground your patients. This particular massage that I'm teaching in this video, so good at bringing about this real nice, sleepy relaxation. Okay, we're back. The camera just overheated. I'm just going to say what I was saying to Leroy about before, so he can remember this. And that is, we were at the feet when the camera overheated and we we're talking about how just doing these holding techniques are fantastic for having your patients instilling sedation into them and making them grounded and just more deeply relaxed. And that sparked the conversation that you're giving almost one of the most valuable things in life, I feel, in your treatments, if you do this correctly, that because we know how hard it is to actually get deep, comfortable relaxation. A lot of people these days do all sorts of breathing techniques, and we're going out to yoga classes, which is fantastic. I'm all for it. Part of my life is meditation and relaxation, and so because of experiencing it so much, I know how difficult it can be to get this incredible deep relaxation that you can get from a good massage. So what can happen as a massage therapist, or especially a learning massage therapist, you feel quite intimidated and you don't have the confidence, and you feel, oh, how can I charge money until I've had at least X amount of experience, right? You can't think like that. You've got to understand that you can potentially be giving someone something they've never had in their life, and you're only going to charge $100 for maybe an hour and 15 massage treatment, and you're going to give them something that they probably can't get anywhere else. They can't get it again, because we all know that a lot of massages leave you frustrated and agitated at the end of it because they didn't address everything enough, right? But you do this right and you'll give someone something they'll never be able to get again. So hopefully that can give people out there some confidence to remember that if you're struggling. It happens to all massage therapists. We feel that we need to go potentially learn something else. Maybe I need to be a physio and then I'll be really valuable. But then you're just going to be treating one particular area. And then every one of your, if you are a physio, and then your patients will lose out on this huge benefit of the body and the mind and the emotional system, everything. Like, you're addressing everything with a massage. So just remember that you're giving something of humongous value when you do this. Just doing some other techniques here, just so you can maybe, get comfortable with how to move around the body a bit and treat these areas a bit more comprehensively. We'll get there, but I'm just doing this because I can feel, I'm not sure if you guys can hear it. It's not cracking as much anymore, but Lee's ankle's creaking and crunching, and so I'm just focusing a little bit on some range of movement stuff and loosening a lot of the tendons and ligaments and muscles around the ankle. So for you guys who are strong and can squeeze, slow it down still though, and do strong strokes up the feet. Always watch their back, for their breath. or for any signs of, oh, that hurts, and then back off, especially right now because we're not taking them through uncomfortable stuff. We're just, doing what we're doing. But I can feel that's a workout. So for most people, it's going to be a workout. So, you've also got to be smart, and a massage is more like a marathon, not a 100-meter sprint. So you've got to conserve your energy. So pick the part of the body where you're like, all right, well, I've got to have a break. Perfect time for a break. They're not losing out, and you're giving your body a bit of a rest. So just going back to the hips, they're perfectly aligned right now, right? Before the right hip was up by about a centimetre. They're sweet right now. And I haven't really tried to do some particular technique that is going to align the hips. The feet are almost good. The right leg is still coming up a tiny little bit longer, where it was maybe 10 mil, now it's about 4. So here you can see the draping again. Quick under the undies. You want to get up nice and high up to the hammies here when you're massaging. So there's no need to do that, right? That can make someone uncomfortable. I'm just showing you guys because that's what a lot of people do. Don't be down here because it'll often stop you from going all the way up here. This is where some of the hamstring muscles attach. So you want to be up nice and high. So again, here you might be able to see it better if I look. Yeah, you can. Really, a lot of my weight is on that arm. Almost sort of 70% of my body weight is being taken by my legs and this arm here. And then I'm just leaning a little bit more onto that left one. So if you get to the point where some of these things you're doing are making someone feel so uncomfortable that they can't relax, hopefully, I'm saying that a bit late in the piece, but typically this kind of massage should not make someone feel like that unless they're super tight and they've got a hell of a lot of tension in their body and they need a lot more of this type of massage. But typically you shouldn't be because you're using these huge surface areas, But if they are, slow it down, back off. But slowing it down can kind of help you with getting to, pull your weight off, so that as soon as you notice, you can back off and make it that little bit softer. So by all means, make this a slow thing, but don't make it slower than their breath, in my opinion. So it's really good to tune into their breath and make one stroke as part of their exhalation. But then don't make it any slower than that, because I want to get you guys in the rhythm of being able to be working with that exhalation, not to be holding a point as they're trying to breathe in. You want to be encouraging and making it encouraging them to be able to take a breath. So when they're breathing in, you're not really putting any pressure on. As they breathe out, you're doing your stroke. And then that's very important when it comes down to when we get into deep tissue massage. It's all about their breath. They're the ones letting the tension go. They're the ones doing the work of letting go. So for now, remember that we've got a long way to go. All these techniques are very important as a foundation to being able to do all the other things that are coming. Deep breath. So in professional situations, look, this is a professional situation. I guess I just mean when I'm more really in the zone, not teaching, not talking, fully focused on getting my patient to get the most value out of this treatment. I get them breathing and breathing a lot. And I encourage them to breath not just through my words, it is through my techniques and through the touch. I do say to them at the beginning, it's very important to breathe. We'll get more into breath work further down the track. It's one of those things that it's another thing that might take away from just being able to focus on rubbing, but I just definitely want to start talking about it. You really want to get your patients breathing. Super important. Potentially almost one of the most important things about this. It's one of the missing things from so many massage therapists and treatments that I've had all over the world, that it's actually quite astonishing. I get shocked sometimes. There have been times where I'm really shocked. And one of the places I was the most shocked was when I went to Thailand. And it wasn't just from one person. This was from 3 different women that I got massages from. As soon as I lay down, this massage starts. I take a deep breath and I'm just like, yes, time to relax, time to breathe. Every time I did that, the therapist stopped. And they were like, "Sir, you okay, sir?" I was like, what are you talking about? I'm just breathing. They were actually totally uncomfortable with me taking a deep breath. So for those massage therapists out there who do get their patients to breathe, keep it up. It's one of the best things you could be doing on the table. It's like the missing link with 90% of massage therapists who don't do that, I feel. That's just me. You can make up your own mind on that. Another breath, mate. Breathe into your belly, really deeply into your belly. Just heavily, completely fall apart, yeah. Relax your face. More if it's not already. Chest, your jaw, whole front of your body, your heart. Really relax, open your heart area. So again here, really give yourself the opportunity to slow down, get into your breath. I'm not nearly into my breath as much as I would be in a normal treatment. However, my clients talk to me heaps of the time in my massages, right? So don't think this has to be some sort of serene, dead silent situation all the time. It doesn't. But I'm definitely not as focused on explanations, of course. And I really take the opportunity to just be aware of how deeply and rhythmically I'm breathing, where my breath's going, trying not to breathe into my lungs, keeping it in my belly here. So even if you can't come this far in doing this massage, this is heaps. I mean, look how relaxed the Lee has already been, how much we've covered. It's fantastic. You can just do with this an amazing treatment, beautifully relaxing treatment that will help people with all sorts of issues. You get a lot of work done just treating the back, huge amounts. The feet, if we look at the anatomy trains, the feet are connected to so many different parts of the body through the anatomy trains. So just treating the feet alone, you could be affecting almost every part of the body, in my opinion. So yeah, address the feet, people. Some people might not like it, and a lot of people I've seen in the past have gone, oh, usually I don't let anyone touch my feet. You're the first person I've let touch my feet. And they've really benefited from it and appreciated it. So yeah, it's one thing again that no matter how good a massage I can get from, in Australia we have these things called remedial massage therapists and myotherapists. They're the two. In America it might be an LMT. And still they don't touch your feet. And I really have not had anyone else except for my students or a reflexologist do a treatment on my feet. And it's really, really important and beneficial. So both times now that I've done these holding point move techniques, Lee's kind of fallen into that really deep relaxation where you fall asleep and then kind of wake up halfway. And yeah. So yeah, hopefully you can kind of see the benefits in doing that. So have a look here. That looks pretty even to me. So yeah, really even, perfectly flat, right and left leg. So we've addressed some things here. And we're not a chiropractor, we're not an osteo, but we can really affect so many different things about the body with this massage. So if you were going to, say, finish a treatment here, what I might do is do some energy work, even if I'm not going to finish here though. Like I'll often do this much work. I'd typically go back to the back, but we're not going to do that because this is more of demonstration purposes, so you can go do that again. I want to get through some more techniques here. But I'm definitely going to just do some energy work here. I'll teach how to do this energy work a bit later on. For now, I'm just going to do it. So for any energy workers out there who are watching this, then yeah, do what you do. And if you just want to sort of follow along at home without, too much of the technicalities necessarily, just do some deep breathing and put your hands on the person's body in the similar areas that I am, but don't allow the weight of your hand to be on the body. Just have your hand just hovering off.